Back in April this year, we all witnessed a tragedy that took place in Ontonagon. Cam Besson, a 17-year-old autistic boy, wandered away from home, and it took several days and hundreds of volunteers and workers to locate him. After watching this tragedy unfold, I saw a need in our community to protect our most vulnerable people with cognitive disabilities. I know firsthand how challenging and stressful it can be for a family that has a loved one with cognitive disabilities. My wife and I have a 5-year-old with Down syndrome. So I began researching ways that the sheriff's offices in our communities could assist with relieving one of the stresses for all these families. Through social media, I found an organization in Virginia called Project Lifesaver International. They are a nonprofit organization that was created in 1999, and they provide the technology and training for organizations to help track and safely bring back their loved ones. The organization utilizes a radio frequency band that the person would wear at all times. If this person wanders away and becomes lost, the Sheriff's Department, along with Superior Search and Rescue, would respond with the equipment that can track and locate the radio frequency. Average rescue time using Project Lifesaver is 30 minutes, compared to several days that it took back in April. After finding Project Lifesaver, I approached my undersheriff, Kevin Coppo, and the late Sheriff Brian McLean and asked for the green light to figure out a way how to implement this program in our communities. Both were very supportive and jumped at the opportunity to assist in any way possible. I asked Undersheriff Coppo if he could reach out to the other 3 sheriff's departments, Keweenaw-Baraga and Ontonagon counties, to see if they wanted to join us. All 3 sheriffs gave letters of support and welcomed the opportunity to assist. After reaching out to Project Lifesaver, I realized that the cost is going to be a hurdle. I reached out to Mike Babcock at Portage Health Foundation to see if this is something that they'd be interested in supporting. Mike loved the idea and encouraged me to submit a grant application. We were very fortunate that the Portage Health Foundation generously provided the funding to cover the initial startup costs for all 4 sheriff's departments, along with the fees to cover the first 50 families to enroll. We hope with the support of the community, we can continue to cover the fees for all families that want to enroll. Starting tomorrow, Project Lifesaver will be in town, and they will be training the 4 sheriff's departments along with Superior Search and Rescue on how to use the equipment and their search strategies and techniques. And then from there, after we get the training done, we will get the rest of the 4 sheriff's department personnel trained on how to use the equipment, with the hopes of starting enrollment in late November, early December for the community.
So the numbers actually for that search, there was 2,474 man-hours used at a cost of $185,557. That's average. Cam was found less than a mile from his house. So with this system, and the search lasted 72 hours. So with this system, he was being less than a mile away. I think if we'd have went to the house, he'd have been found in 10 minutes after we got there. So he passed away less than a mile from his house with, if you want, we can show you the maps that we covered. We covered pretty much every inch with something, and he was found laying underneath a tree, so from overhead we'd have never found him. So with this system, that would have been just fantastic. And I always say, hopefully, everyone has this system implemented, and 10 years from now, we say, hey, how do we use that? Because nothing ever happens. I would love it if we had this technology and we never need it, but if we need it, it's going to have a much better outcome than I had. Because I have to tell you, that's, as I've been sheriff for 9 years and undersheriff for 12, and that was the worst day of my career. Telling the parents that we found him, but not alive.
Thanks to all of you guys for those statements. One thing I want to add is that we do have a donation page online, so if somebody wanted to support this ongoing cost, the hope is that none of these families that participate in this will ever have to pay money to use it. So if anyone wants to make donations, phfgive.org/Project Lifesaver. And with that, I want to open it up to questions. Anybody, if you guys have any questions for anybody that's here.
The band that the person would wear is a RF transmitter, a radio frequency transmitter. It's about the size of probably a Fitbit. It'll be able to go on their wrist or their ankle, and it's something that can't be removed unless you cut it off with scissors. And it's better. It's older technology than GPS, but it's better for our area because foliage, weather conditions, buildings, lack of satellite cell phone coverage will affect your GPS signal. Where a radio frequency signal, generally none of that really affects the radio frequency signal. It's 3 days of training. It's obviously training on how to use the equipment, and they're going to be training, teaching us on search techniques and what to look for with people, what behavioral patterns the people with cognitive disabilities display when they wander, and probably a lot of the training will have to do with administrative, how to implement the program and keep it going forward. The training is also, it's a train the trainer, so it's an instructor training. They're coming here and training 8 of us from the 5 agencies, and then the ones that go through the training will become instructors, and we'll go forward and we will train the rest of the personnel in all the sheriff's departments in search and rescue. So everyone that in the departments, everyone will be trained on how to use the equipment. And each sheriff's department will have 2 receivers that can pick up the transmission of the radio frequency. So each sheriff's department will have their own equipment, and Superior Search and Rescue will be able to assist any of the sheriff's departments with a search. I believe there's going to be an application process that Project Lifesaver has come up with, but from what my understanding is, people with cognitive disabilities, for example, this could be implemented with elders with dementia and Alzheimer's, people with autism, Down syndrome, just something that where they're cognitively disabled and they may not be aware of their surroundings and they could wander off. It takes a matter of seconds. You turn your back and they could be gone. Each band will have an individualized radio frequency number assigned to the person that is wearing it, and it can't be picked up. The machine that we have will be the machine that tracks it. The machine's not always on. The equipment will be carried in the main patrol cars that are used for daily patrol. So if the family calls and says, "Hey, my loved one wandered off," we can have an immediate response from whoever's working the road and immediately respond. And the goal is to, like I said, Project Lifesaver prides itself on having 100% rescue rate since they've been implemented in 1999, and their average rescue time is 30 minutes. I believe that the initial startup cost for a family to enroll is, I believe, $350, and that includes the transmitter and a year's supply of bands and batteries. The batteries need to be replaced every 2 months, and to replace those batteries, law enforcement, we will go to the families or have the families come to us, and we will be the ones that replace the batteries for them. So the initial startup cost covers their year's supply of batteries and bands and the transmitter. The bands get cut off when we change the batteries, so the bands are meant to last at least 2 months. We will cut the band off, change a battery, and we'll replace the band with a new one.
It is important to note there were several other instances as well as the one in UN this year. So this has happened multiple times. And then the other part, if there are any families that are interested, they can go to that same website, phfgive.org/Project Lifesaver. And while there, they can fill out a form saying they're interested, and then their local sheriff's office will get in touch with them. Or they could call the sheriff's office. Each one of the sheriff's offices will be the ones that kind of work with the people that live in their county. So without anything else, I think we could probably finish up here. So thank you guys so much for doing this. Really appreciate it.
Thank you.
Thank you.
Thank you.